Hi everyone, thank you so much for joining us for On Call for All Kids, a weekly segment that we have to talk about timely news in pediatric healthcare with our experts here at Johns Hopkins All Children's Hospital. Today we have with us Dr. Patrick Mularoni. He's an emergency medicine physician here at our hospital, as well as the medical director of our sports medicine clinic here as well. So today we're going to talk about overuse injury. Dr. Mularoni, what is this and why does it happen?
So an overuse injury is an injury caused by repetitive body motion. It can occur anywhere. So it could occur in the workplace if you're doing the same work over and over again, but it can also occur on the sports field. And we see it in children who are playing sports year in and year out. When they're doing those same motions over and over again, you can cause an injury to the joint.
Is this something that's just unique to Florida, these kids playing year-round, or is this just a trend we're seeing nationwide, worldwide?
Well, actually, you know, the great weather we have here in Florida allows kids in outdoor sports to actually play those sports outdoors year-round. So if you're a kid that's playing football or soccer or baseball, you can actually do that year-round. But also sports medicine physicians up north are seeing the same thing. You can play soccer indoors, you can swim indoors, and we're seeing that. And then we're seeing these hitting and batting academies show up for baseball, where maybe the child isn't playing a full game on a full field, but they're going to these hitting and batting academies, and at those places they're actually having increased reps over what they'd be having in outdoor fields. So that's leading to further overuse injuries.
Is there a reason why kids are specializing in these sports these days?
Well, you know, there's a lot of answers to that question. The first thing is that the sports are available year-round. You know, when we were children, you could play a sport and then the season would end and then there'd be a different sport to play. All of us remember playing different sports growing up. And we have a lot of media perception that children are better when they play year-round. We've seen the pictures of Tiger Woods at a very young age putting, and we know he played straight through, or Wayne Gretzky skating. So parents get that perception. The second thing is the industry of sports, that the leagues are owned by someone who's going to run the league year-round, and the coaches, many of them, that's their job, so they keep the teams moving year-round. And the perception is reality. Children at 5, 6, and 7 that are playing a sport year-round, since they don't have downtime, they maintain those skills. And some of the kids that might just show up for that season might not have those skills. What unfortunately ends up happening is that kid eventually ends up hurting something, and they end up with an overuse injury, or they just burn out. They're just sick of doing the same thing for 5 years straight.
Let's talk about Little League Baseball. We're in the spring season. So in this, we see a diagnosis called Little League elbow. Can you tell us a little bit more about that? My son plays baseball too. Gotta look out for it.
So Little League elbow is unique to baseball, or unique to throwing sports. And what can happen here is Little League elbow is actually something called an apophysitis or an epicondylitis. And if the child throws a lot, they can develop pain at the medial portion of the elbow or the inside portion of the elbow. What's going on here is that the muscle's getting very strong, the tendon's very strong, but its insertion into the bone is not very strong. So that's the area where inflammation will show up. As opposed to adults, you know, you'll end up, many of us have heard about Tommy John surgery, where they actually rupture that medial collateral, ulnar collateral ligament. That doesn't happen in kids. What happens is apophysitis, where that strong muscle and strong tendon pulls on that bone, causing inflammation. The child will complain of elbow pain. It starts out nagging and then gets gradually worse and worse. And at some point, you'll end up seeing that your child's hurting when they come off the field, or maybe not throwing as well.
So that's maybe not just unique to baseball. Can you see that in other sports as well?
You can see it, but it's most often, Little Leaguer's elbow is most often in baseball. Now, there are other apophysitis or other areas that you can get apophysitis that occur in other sports. In our jumping sports, like volleyball or basketball, in that landing mechanism, the quadriceps tendon pulls on the patellar tendon. So just on the upper part of the leg, kids will get something called Osgood-Schlatter that is a lot more common and many people have seen. In our running sports, like soccer, we'll get kids that have pain at the back of the heel from that strong calf muscle and that strong Achilles tendon, where it inserts into the bone there. It'll cause inflammation at the bone. Whereas adults might rupture their tendon, kids don't do that. They get something called apophysitis, which is more a nagging, inflammatory type pain.
All right, so what's the takeaway for those parents that are watching right now? When do we maybe need to get our child seen if we're kind of seeing something's going on with them?
Well, you know, an acute injury is something that's very obvious. A child trips, falls, breaks their arm. Parents know when to bring that child in. The problem with these overuse injuries is that they're gradual. Your child maybe complains about it 1 week, and then it's 3 weeks later and they're complaining on a daily basis. So I think the first thing to know is that playing through pain is okay when it's muscular. Muscular pain is okay every once in a while with a hard workout, but if it's a joint pain in a child, that's not okay. If your child is having pain in a joint, they need to be seen. That's the first thing. The second thing is, if you notice your child's playing differently because of pain, so they're not throwing the same, they're not running the same, they need to be seen. And the last thing is, if you notice your child is sitting days out or is limping when they come off the field or not using an arm, that's another thing that, you know what, it's gotten too far. They definitely need to be seen.
All right, Dr. Mularoni, thank you very much. Very good tips. If you have any topics you'd like us to cover, just comment below, let us know. We'll try to get those covered for you. And if you just want more information about pediatric healthcare news, you can go to our website, HopkinsAllChildren's.org/newsroom. Thank you so much for being here.
Thank you.